Zambia, the podcast where we connect health professionals, community voices, and policymakers to drive real conversations around public health in Zambia. Today, a dream which has always been around is finally becoming a reality. So we're welcoming you to our first episode. And I am your host, Melisa Lewanika. And today we're talking about something fundamental to life and health: water, sanitation, and hygiene, simply called WASH. In most parts of Zambia, both rural and urban areas, we have issues that are affecting our health, starting from access to clean water, safe toilets, proper hygiene practices. Despite the challenge being bigger in rural areas, we are glad to see that we're able to make a difference between life and death, especially for children. And for that, we bring to you a man who understands WASH to help us understand more about WASH, its impact, and the efforts being made. We are joined this morning by Mr. Emmanuel Ngulube. Welcome, Mr. Ngulube. Thank you very much for being here with us.
Thank you very much, Melisa, and I'm glad to be part of this wonderful discussion that we're going to have.
All right, so let's start with the basics. When we talk about WASH, what exactly do we mean, and why is it so critical for public health, especially in rural areas in Zambia, to consider matters pertaining to WASH?
Thank you very much, Melisa. Indeed, basically WASH, we're talking about water, sanitation, and hygiene. So when you look at these three components, they make something which gives us a way that we're supposed to live, because water itself in itself is something that is very essential to our health living. Sanitation also comes in, because without sanitation, even when you have water, it is very difficult to have dignity, because that borders on dignity. So that, coupled with sanitation, makes the entire package whole.
So what are some of the WASH-related challenges in rural communities? Looking at it, we're not just looking at Kazungula itself, but I believe you've had access to these other parts of rural places in Zambia. What do you think are the main challenges bordering WASH issues today?
So to explain more on challenges, first I will talk about the importance of WASH itself. So WASH, when you go by the UN declaration, it's a human right. So each person, whether be it in rural or urban areas, is entitled to have full WASH services. So now when you look at our rural areas in Zambia, and even just maybe worldwide, there are a lot of challenges that we face pertaining to WASH. One of them is having limited access to clean water sources. So this is a challenge whereby you find a community will be here, and for them to just access clean water, they have to move kilometers and kilometers. And again, sometimes you may find that even when they move through these long distances, the kind of water they find, it's not even clean itself. But because they need this resource called water, they'll have to move. The other challenge is poor sanitation facilities. You may find that in communities, yes, they understand that they need to have good sanitation facilities, but just how to make these sanitation facilities in a way that is acceptable is also a challenge. The other challenge that we have is poor hygiene. You may find that hygiene messages have not yet maybe reached out to most communities. So this poses a danger, because you may have water, just like I said earlier, you may have also good sanitation, but if your hygiene is not okay, all these efforts equal to zero. So these are some of the challenges that we have when it comes to WASH, providing WASH services.
It's amazing to see the challenges that are bordering issues to do with water and sanitation and hygiene in the community. So looking at the health impacts towards poor WASH practices, how do these WASH challenges translate into actual health outcomes, especially for vulnerable groups like children and women, especially the children under 5?
The most affected, just like you said, are the children, the under 5 children and women.
Yeah.
For the children, you may wish to know that their bodies have not yet adapted to the harsh realities of life. So you may find that any amount of contaminated water or anything which is not clean that they may ingest, this will have an effect on their health. So this brings about stunted growth as well as malnutrition in children. Also, the other impact is the prevalence of diarrheal diseases, cholera, and other even skin infections. Because when you talk about skin infections, these come about because of poor hygiene, which is coupled with having limited access to clean water. Then when we talk about women, we're talking about issues of menstrual hygiene, lack of clean and safe water, or maybe just limited access to water. This makes it very difficult for women as well as girls to properly manage menstrual hygiene. Then when it comes to school-going children, this also has a negative effect on them, most especially girls, because this, when there's no proper sanitation facilities, water is not there, hygiene is not properly done, you find that a girl would rather just miss school because these facilities are not there in school. So this has got a very big impact on school attendance when it comes to pupils.
I'm glad that these things are coming out. It's beautiful to see that WASH actually encompasses a big spectrum of people around it, and you brought out the issue of menstrual hygiene. So would you agree with me if we're to say that most of these girls, menstrual hygiene also and WASH issues contribute to them dropping out of school, and that these diarrheal issues also contribute to these children in schools not performing well when it comes to their education part?
Yes, most definitely, Melissa, because each day that a child misses at school, that brings them backwards. Why am I saying this? His friend will be learning. Of course, maybe the teacher may not even pause to say, because maybe one child is not there, one or two children are not there, and then we're not going to learn today. That's not what happens. The child may miss school because there's sanitation facilities are not there. There's poor hygiene. Wash facilities are not there, in short. So that makes it hard for them to catch up even when they come back. So this leads to poor performance when it comes to school-going children. Okay. Also, nutrition-wise, yes, because most of the times find that these children will be sick. So that brings their nutrition and health down.
Okay, no, thank you so much. It's wonderful to know the issues around WASH. Looking at our public health podcast Connect, we are all about the real issues out there. So do you have a story or an example of a community in these rural settings that has struggled or improved thanks to WASH interventions?
Something positive is happening. One good example I'll give you is the community of Guta in Nyawa Chiefdom, Nyawa Ward. So this is one of the communities. There's even a school there where the nearest source of clean water is about 17 kilometers. Wow. And maybe the nearest source of unclean water is about 8 kilometers. So both sources are very far, whether be it clean or not safe. But recently, that was in 2024, with our partners, World Vision, we drilled a borehole there. Firstly, it was a rough experience anyway. We hit about three dry holes, but through persistence, we managed to secure a borehole, and this borehole now is servicing more than 7 villages, as well as a school, Guta Community School. So now, when you go there, you are able to see the improvement which is there as the only source of clean water which is there, both for the school as well as the community. The borehole is ever crowded. Nevertheless, we are happy to see that at least we are moving in the right direction. A source of clean water has been provided for the community, hoping that is going to add on the on the impacts that provision of good wash services does to a community.
Good story. We are glad that something has been done and given hope to the people, even in the furthest parts of rural Zambia. Looking at challenges, for every challenge, there should be solutions. So, considering wash interventions in these rural areas, let's talk about the solutions. What interventions has you, your office, your team introduced to improve wash services in some of the parts of the rural areas around Zambia?
To begin with, wash itself is quite broad, and when you look at our setup, mainly I think these challenges are more prominent in rural areas, like you said, because you may find that they are hard to reach areas, and also when you look at just the setup itself, the way people settle, it's difficult. But nevertheless, we have to endeavor to bring these services as closer as possible to the people, so that we all feel as part of this big community called Zambia. So what some of the interventions that are being done with regards to provision of wash services, the first one that I will mention is the drilling of boreholes. So we are drilling boreholes in both communities as well as institutions in rural areas, with a view to bridge the gap between where the community members, the rural community members, are getting their water now, which is unsafe, bringing it closer to their households. So when we drill these boreholes, we either feed them with hand pumps, commonly known as biguju,
Okay.
as well as construction of pipe water schemes, where we feed with either a solar powered submersible pump storage facility, and then we run a network, then people will be drawing water from taps. Then the other intervention is when we have boreholes, some of them they break down with time. So we come forward and rehabilitate these broken down boreholes. Not just that, we also promote the construction of latrines in communities as well as institutions. We've got a program called community-led total sanitation. So in this, we encourage communities to build their own toilet and observe good hygiene, so that we try to bridge the gap. We try to reduce the disease burden which is there. The other thing is we support in institutions, in schools. We support wash clubs as well as menstrual hygiene clubs, so that our school-going children, or the learners, they know about these things. As we know, children can be the best agents of change. So when these children are trained in wash issues, it will start from there, and then they will take it even to their homes. They will educate their siblings, either their brothers, their sisters, even their parents, whoever they are staying with. Once they grasp this message, they'll be able to teach the people that they live within the communities. So we also target learners by forming school wash clubs as well as menstrual hygiene clubs.
Thank you so much. Considering the distance from your offices to some of these communities, and then you spoke of an issue of having boreholes that break down and things like that, how involved are local communities in these efforts? Looking at some places are far, sometimes there's network challenge. So how involved are these communities when it comes to some of these challenges or solutions?
In as much as these interventions are coming from this end, what I mean when I say this end, from the service providers, but they are intended for the communities, and the communities are the ultimate beneficiaries of these interventions. So whether be it water points in terms of hand pumps or pipe water schemes, or the promotion of construction of latrines or menstrual hygiene, it is good to note that communities they are involved, because from the beginning of each intervention, community engagements are done before, during the implementation of the interventions, as well as post. So we start with let me dwell much on the post. involvement. So after the intervention has been put up, let's say for instance a water point or a borehole, we ensure that a committee called a water point committee or viewership committee is formulated within the community where this borehole has been put up, with a view to ensure that one, sustainability is there of this water point. Two, also to make sure that this committee also educates other community members on how they're supposed to take care of the water point, as well as other wash related issues within the community. Then the other thing is we also involve local leaders, whether be it the councillors, the WDCs, the traditional leadership, the Sibukus, or section chairpersons, whichever leader that may be there at that community level. We engage them because we understand that we as a service provider may not be there always, but we entrust the responsibility in these leaders to help us to ensure that they take care of these interventions that have been put up by either the government or partners that handle wash issues. So yes, involvement is there, and we also endeavor to make sure that the communities are aware to say this intervention that has been put up, is their responsibility to take care of it, so that even after 10, 15, 20, even 30 years to come, this intervention will still serve them, so that it just doesn't end with their generation, but it also has to help the generations that are yet to come.
All right, so that's very wonderful to learn. So this simply means that even when it comes to issues around sustainability, there's community being involved in sustaining the wash interventions that you've put across in these communities, which I feel is very good and should be emulated by all communities out there. So heading to our emergency response, looking at Zambia itself, 2023-2024 season, where we didn't do so well and we were hit with drought. You mentioned earlier of how you had three holes dug up and they were dry, and it was very challenging. Now, looking at how drought has contributed, what are some of the things, or how has drought affected wash in some of these communities?
We were unfortunate during the 2023-2024 rain season, where we had prolonged dry spells. This may not, yes, it may have been severe that year, but I think even just in the past 5 years, we've not had very good rainfall pattern. So this now puts a strain on the water sources that we have, because you may note that the groundwater, the boreholes that we sink, we utilize the groundwater, and this groundwater is only recharged from the rainwater that comes. So if the rainfall activity is reduced, this translates to reduced recharge into the groundwater. So now you know that or you learn that through these reduced rainfall activities, the groundwater recharge is reduced. So this entails that the moment that maybe you'd want to drill a borehole, maybe in the past you were able to get water at 50 meters, 60 meters, but now you need to do better. Like you need to go deeper so that you find water. Also, some boreholes that have already been drilled, some of them that are not that deep, are drying up. So now you find that a community well enough had maybe a borehole that it was relying on for provision of clean and safe water, but now all of a sudden this borehole starts giving them challenges. They can no longer get the quantities of water they were getting from this borehole. So yes, we've had partners that have come aboard to help, like UNICEF, as well as World Vision. They've helped us to rehabilitate boreholes, also support us with wash kits, where they gave us chlorine to distribute amongst households, so that those they may not have access to clean and safe water, they can use the chlorine to treat the water. So this the partners that we've had, they have really helped us to ensure that to avoid this some of the calamities that we may have faced because of the prolonged dry spell that we had.
That's very good. It's good to see that you have a number of stakeholders being involved in the whole issue towards WASH. And the most beautiful part is to see community involvement, which is extending to ownership. Looking ahead, what are your top priorities for WASH in these communities that you're serving?
To expand access to climate resilient WASH, because the era that we are moving into, or that we are into right now, it's an era where you find climate change is bringing a lot of negative effects. So even in our interventions that we're giving out, we need to be aware to say, in as much as we're giving out these interventions, we need to take care of the issue of climate change. So our WASH interventions, they need to be climate resilient, so that tomorrow or the other day, we shouldn't face the same challenges that we're facing now. Then the other thing is to improve sanitation coverage through continued effort with other partners to ensure that the COTS, the Community-Led Total Sanitation Program, is rolled out to all the communities in our district. Then the other thing is also to intensify the WASH campaigns, so that each community is aware that these three things, water, sanitation, and hygiene, they can't be separated.
To Mr. Emmanuel Ngulube, thank you so much for your time and for being with us. To our listeners, thank you for tuning in. Don't forget, clean water, safe sanitation, and good health and hygiene are not luxuries. They are rights. They are health and they are life. Stay tuned. We have another surprising guest and topic for our next episode of Public Health Connect Zambia. This has been your host, Melisa Lewanika. And until next time, stay informed and stay healthy. God bless.